For my contemporary issue presentation, I chose to focus on abortion and reproductive rights. So some history about abortions. Abortion goes far back into history, further than I could find information on, but most of the historic facts on this page are from 17th to 19th century, and then it goes into play even into current times as well with all of the anti-abortion movements and heartbeat bill movements that have been occurring recently. Um, Anti-abortion laws were first put into place as a form of poison control. In the past, women would ingest dangerous chemicals to carry out abortions and terminate their pregnancy. So that law was put into place, banning abortions to save pregnant women because women were calling for desperate measures. They were doing anything they could to terminate this pregnancy, and it in turn would end up hurting and harming the health of that pregnant woman. Women's rights movements are still something that occurs today frequently, and so anti-abortion laws were kind of and put an act to say we still have control over we can still have a say of what you do with your body. This baby is not just yours, you can't abort it. Birth control also acts as a threat to male dominance. That by controlling women and saying when and when they cannot have abortions, it helps assure the role of male dominance in men. By traditional motherhood role of women being maintained, by doing that, they're confining that woman to be childbearing, whether they would like to or not. They are not able to choose to not carry that child to term. They want them to know that their role in society is to birth children and repopulate the society with new children, and that is the woman's role. Doctors were also able to take business from midwives regarding child birthing and prenatal care. The whole concept of being pregnant and receiving care during that time, doctors were able to take back control from midwives. Then with racism and white supremacy, it was mainly white male doctors targeting black midwives because there was a decrease of birth in white Protestant children in the late 1800s, and there were many blacks being born. And then there was immigration occurring at this time as well, so there was an imbalance of different cultures because of the travel to America. So there was too many blacks, and they were afraid of racial suicide by being completely overtaken by the African Americans, and there wouldn't be any whites left. So they wanted more whites to be reproducing, which is another reason why they put into this place this anti-abortions law. The relevance of this issue is very relevant. I remember just before the presidential election talking about what they were going to do to be stopping abortions, that women weren't able to go to free clinics or affordable clinics like Planned Parenthood and receive abortions. It was not their right to make that decision. There's been many women's rights movements to support the same cause. So I thought it was a good issue to bring a little bit more light to and look into a little bit deeper. Also because the recent controversy regarding the heartbeat bill, which is a bill that bans abortion past a certain week of gestation or week of the child being alive inside of the mother's womb. There is also a presence of unsafe, illegal abortions, even though abortion is no longer legal. Women are doing anything they can to get an abortion. If they want one, they are going to get one way or another. In the past, going back to the history, women could pay large amounts of money, and some doctors would do these abortions. So wealthy women would be able to get their abortions, but poor women were not. It would even get to the point where they were using sharp objects such as a coat hanger or a knitting needle and inserting it into their vagina to terminate the pregnancy, or they would douche their vagina with harsh chemicals, ingest harsh chemicals to terminate that pregnancy, which was then causing harm to the mother, the woman. I think that women should have an input on the care that they are receiving. I am pro-choice, but I'm also pro-life. I guess I'm somewhere in between. There's times when an abortion would be medically necessary, like if the mother's life is at risk, she's not going to make it through. An abortion would be necessary at that point to save that mother's life, because if the mother doesn't make it, the baby's not going to make it either, and taking two lives is just not fair. And then there are times where it's not necessarily necessary, but the mother still might not want to carry that child, may not want to have that child, and that is that individual's choice. There are other options available, and I am aware of that, but everyone should be able to make their own decision. They shouldn't be carried with, they don't want this baby, but they've got to carry it for 9 months because they're not allowed to make the decisions that fit their needs the best. I think it's very important for nurses and nursing students to learn about this information, because as nurses, we are supposed to advocate for patient safety and patient care. We're supposed to be making sure that whatever the patient needs that will fit their life best and make them thrive the most, that is the care that they will be receiving. So some statistics about abortions recently. According to the CDC, they have a tracking device, basically, that all reported abortions get put into a database, and they do different statistics and ratios on it. They do this with all different sorts of care, not just abortions. In 2018, there was 619,591 legal abortions reported. So this is only the abortions that were reported, and that's not including any illegal abortions for women that aren't able to access care that they need. This was focused between ages 15 and 44, and that was about 11.3 abortions every 1,000 women. And for every 189 abortions, there was 1,000 live births. 57.7% of these abortions were women in their 20s. And then for when the abortion was taken place, 92.2% were performed before or at 13 weeks gestation. 6.9% were performed between 14 and 20 weeks gestation, and 1% were performed after 21 weeks gestation. The population affected here, it could affect multiple people in a woman's life, but the primary population affected is a pregnant woman. Whenever speaking directly about abortion, it is primarily going to affect pregnant women, because those women are the people that are going to be seeking out abortions. A non-pregnant woman isn't going to need an abortion. Someone that's not childbearing isn't going to need an abortion. The reason that a woman could be seeking out an abortion could be for numerous reasons. It could be that they just don't feel like they are fit to be a mother. They don't want a child. This is a burden on their life at the time. They can't handle it. It could be because the woman's unsafe. It's unsafe for her to carry the child. It could end up potentially killing her. She's very high risk. So she might be seeking an abortion to prevent herself from having further health problems. She might have been told that it is extremely dangerous for her to get pregnant, and birth control didn't work, and now she is looking for an abortion to be sure that she is watching out for her own safety and health. It could be because of poverty. If women are living in poverty and they cannot appropriately care for a child, yes, they could put the child up for adoption, but that adoption family, that foster family, might end up being a family in poverty as well, that can't afford to support another child. They're just doing it for the paycheck. And so women in poverty might be seeking out an abortion. And the women's rights affects women in general. Being told that you can't make decisions about your body, you can't make decisions about your health care, is frustrating. And so it affects all women for them to know that if there was a situation where they were to need an abortion, they are not going to be able to access that care. The influence of social media is strong on any contemporary issue right now, as we had seen in the past lessons in this course. According to a study, abortions on television shows and news broadcasts, they they've been more frequent in recent years. However, in movies and TV shows um, produced by big name production companies, the information can be displayed ineffectively. It could be misinterpreted by the audience. They could be trying to send a message and it could go the other way, which causes an outlash by population that are watching the show or the movie. And it could have a political agenda behind it as well, so that those companies are supported by or being paid money for showing this political agenda in a way such as an abortion, so that people believe or understand what they want you to. Social media displays an increase in advocacy, which we've also seen that in many different circumstances. You get a big name celebrity, they're on board with something, they're going to start their own trend, they are going to start a movement, and they're going to make sure that it is aware that they are advocating for that. There was a news article on one of the websites, and it was about the actress Busy Phillips. She had started a trend on Twitter to speak out about your abortions, and she started a hashtag you know me, and it became an internet campaign. It went viral. It had over 10,000 retweets and around 50,000 likes, and that was comparable to the Me Too movement about abuse and abusive relationships, and it took off fast and shined a lot of light on the shame with abortion. Potential barriers to care are the residential area of the patient. If they live in a certain state, they may not be able to get an abortion under certain circumstances. So they might be just a little bit too far along. They're not allowed to get that abortion anymore. So people might be looking for other places, but there's a travel barrier. People don't want to travel across the United States because that causes a financial burden. They might not be able to afford travel expenses to stay where they are going, and they might not be able to afford to miss work as well. And they might not even have access to transportation to get to the place that they need to go, which then causes a delay in care. Due to these barriers, there's a delay because women that choose to terminate their pregnancy, they end up waiting longer to terminate because they have to find a facility or a state that can do it for them, and then they end up terminating pregnancy at a later gestational age than it should be done. Due to barriers as well, women could choose to terminate the pregnancy at home, which is what we had talked about previously, and it causes harm to the woman. It can cause serious harm if it's not done properly. If there's any sort of infection, the woman could be in a lot of pain, and she could be at risk for further health complications. One nursing intervention that I chose to focus on was educating the patient. Educating the patient is something that we always talk about. And this is a scary procedure that some people opt to have done, so they're going to need information about it. The patient should be educated about the procedure and what should be done. So there's two different options. You can have a pill abortion, or you can have an abortion, which is a procedure in the office. If the patient is receiving the pill, then we could notify them of how to take it and what the possible side effects are. If they're receiving the office abortion, then notify them of how the procedure is going to be done and what symptoms they can expect following the procedure, so they can have a better knowledge about what is going to happen to their body. By educating the patients, you're advocating for the patients and making sure they have all the information they need, so that if they end up deciding that that's not what they actually want to do, if that's too risky for them, for their health, or if they've decided that they don't want to go through with it, they have all the information that they need to make that decision. And as I had said before, educating patients is one of the nurse's primary jobs. So it is our job to make sure these patients know all of the information before making any decisions, before deciding what to do with their care. The second nursing intervention that I had put in place was monitor the patient. If the patient is having the procedure in office, the nurse is going to want to monitor them throughout the procedure. If the patient can be slightly sedated or completely sedated to where they are asleep, If the patient's not sedated during the in-office operation, the nurse should be sure that the patient is comfortable, not experiencing any abnormal pain or cramping, because if that is the case, then the sedation is not working correctly. And it could indicate that something is going wrong or something's not right. That patient knows that something's just not right. Following the procedure, there should always be a healthcare provider or any nurse near the patient, especially after coming out of sedation, to make sure that their respiratory status is adequate and their cardiac status is adequate, and that they wake up from that sedation okay. These patients should also be monitored for bleeding, because just like with postpartum, there's a risk for bleeding because they've had trauma to the reproductive area. So it should be monitored that they're not having excessive blood loss, to be sure that they're not at risk for fluid volume deficit and blood loss. A third intervention would be to provide follow-up for this patient. They're going to be leaving that facility. If they're doing the pill abortion, they might even be doing it at home. So they need to have all the information as they should. The nurse should provide the patient with counseling options just in case they feel like they need to talk to someone about the decision that they had made. And they should have a follow-up appointment with another health professional to be sure that with the doctor, to be sure that everything went as it should. So the nurse should make sure that that is set up for them, make sure that all of the information about that appointment is in the possession of the patient. The nurse will also provide the patient with a 24/7 support line or helpline, just in case she took that pill, she's having some weird symptoms, she doesn't know if that's normal or not, so she can call and find out if that's supposed to be happening or if she needs to go seek immediate care at an emergency room or call 911. By providing the patient with follow-up care and resources, it will give them knowledge about who to reach out to if the patient is unsure of what is going on. Is this normal? Do I need help? Am I in trouble? Which will in turn help protect the patient's health and well-being. By providing support contact information, the woman will know that she's not alone. She's got people that she can talk to if she needs to. There are people available there that support her decision, and she can ask any questions that she needs to, because they are going to have the resources to answer those questions and get any issues resolved. Social issues that could stem from abortion. Two main social issues would be depression and abuse. Depression, I'm looking at more if the abortion was medically necessary. If the abortion's medically necessary, she might feel like she's not good enough. She can't carry that child. She had to take that child's life so that she could save her own, and that might make her depressed. She just lost her child. This could lead to suicide or substance abuse. When people get extremely depressed and they don't have any outlets, they might think that there's nothing that will ever make them feel better, that they can't go on living like this, and they attempt or commit suicide. Substance abuse is just like that. There's no outlets except they find an outlet, and then they have substance abuse issues, which will lead to further health complications. Abuse, I was thinking about the Traffic movie whenever I was writing this. The woman that got pregnant, I mean, she was not treated right. She didn't have access. And so if she would have had access to appropriate abortion or appropriate health care, she wouldn't have had the issues that she did. But she hemorrhaged, and she very well could have died because of that. Because of that abuse that she was receiving. Physical abuse, if someone doesn't like the decision that she made and she made that decision on her own, she could, if she's in an abusive relationship already, she could get further physical abuse of that. Mental and emotional abuse, people telling you that you are a monster, you killed your baby, you didn't do the right thing. That's abusive, and it can make the woman feel very negative about what she decided was best for her. How can nursing care regarding abortion be changed in the future? I think it's very important for all nurses to set aside their own bias and opinion. If you are pro-life and you don't think this person should be getting an abortion, that's fine. That's your opinion, but you should not be telling the patient that. You are there to support the patient, to make sure that they make the best decisions for their lifestyle. You should focus on the well-being of the patient rather than the procedure that was completed. She might not want reminded of having to have an abortion or choosing to have an abortion. So focus on her healing process, how she's healing, how she is doing, rather than the abortion's over, how do you feel? And it's important to consider what's best for the patient rather than the public stereotypes. There is a lot of backlash regarding abortions and women's rights regarding health right now in society. And so that should be put aside, shut in the closet, and not looked at while caring for this patient. The patient should be the focus, and what's best for that patient, what fits that patient's lifestyle, is what should be focused on. And these are my references. Thank you.